This Seniors Empowerment Workshop session is being organized by the African Canadian Women Engagement Society, also known as ACWES. ACWES received this funding from the federal government of Canada through the New Horizon for Seniors program to enable senior women to combat isolation and adjust to the current and post-COVID-19 environment. The mandate of the African Canadian Women Engagement Society is to provide economic and social development support through capacity building initiatives to Black, visible minority, and immigrant women and young girls. Other initiatives of the organization are to combat sexual and domestic violence and train vulnerable individuals through basic career training and computer skills, microloan projects, and community mobilization through information sharing sessions. ACWES promotes stable communities and activities rooted in peace, independence, and self-sufficiency to facilitate the growth and development of women, youth, and less privileged members in our community. ACWES achieves its mandate and upholds its vision by providing direct services to as many as 134 community members annually. These services include 1. Providing a social and advocacy support system for women impacted by violence and connecting them with appropriate social and justice systems. 2. Increasing accessibility to social programming for Black, immigrants, and visible minority senior women to improve their community engagement and combat social isolation and loneliness. Facilitating the transfer of employment and business knowledge to Black and immigrant young girls and youths. And 3. To combat food insecurity through the provision of nutritional food to vulnerable families. Welcome to the Seniors Better Living Workshop. This session focuses on better living to enable seniors to adjust to the current and post-COVID-19 environment and increasing community participation to combat social isolation and loneliness during and after this pandemic, focusing on the following. Medication awareness strategy for seniors, where to seek medical support when a senior is in danger, who to get prescriptions from across Canada, what guidance is required before taking medication, and how to navigate the healthcare system strategy for seniors. We're going to start with medication awareness strategy for seniors and improving prescription drug safety for seniors. Nicole F. Bernier, author of an Institute for Research on Public Policy study entitled Improving Prescription Drug Safety for Canadian Seniors, shares that experts have pointed to increased drug utilization as a driver of healthcare spending in Canada for some years, but safety issues are increasingly salient. Seniors are 5 times more likely than younger Canadians to be hospitalized as a result of an adverse drug reaction. In 2011, over 27,000 Canadian seniors, that is 1 in 200, had an adverse drug reaction related hospitalization. A study by Health Research Services found that 12% of Canadian seniors taking 5 or more medications have experienced an adverse reaction requiring medical attention. Research further shows that improving drug safety among seniors requires systemic change. According to the IRPP study, governments could use legislation and financial instruments to much greater effect to steer the country's efforts in the right direction. Required is a comprehensive national strategy which involves leadership and engagement from Health Canada, provincial and territorial health ministries, and local health authorities. Provincial and territorial pharmacare programs should also be extended to provide broader and more systematic coverage of effective non-drug therapies whenever appropriate to treat older patients with chronic conditions. Currently, in pharmacies across Canada, they have a better program that if you are getting your prescription from the same pharmacy, they're able to monitor any adverse drug reactions that might come up with new medications that are prescribed. So there is some effort towards getting this program up and running better in Canada. Where to seek medical support when a senior is in danger. What you can do when abuse or neglect is happening to an older adult in your life. Everyone has the right to be safe and free from abuse or neglect. No one should experience abuse. It's not right. As neighbors, friends, and family members, you can do several things to help. You don't have to fix the problem. Caring about the people around you and paying attention when there are signs of trouble are important steps. Small actions can make a big difference. What we all need to know about abuse. Ageism is discrimination against older adults because of their age. Ageism is a factor in the abuse of older adults. Everyone has the right to live without fear. Everyone has the right to have control over their life. It is abuse if someone uses their influence or ability to limit or control the rights and freedoms of an older adult. The abuse is never the older adult's fault. Most older adults who experience abuse are healthy and capable of making their own decisions. Many types of abuse are against the law. All abuse is unacceptable. Older people affected by abuse are often isolated, and it can be hard to see the signs. Impolite behavior or rudeness is not abuse. It is important to understand that abuse means there is an abuse of power involved. You cannot control the abusive person's behavior. It is not your responsibility to make the abuse stop, but you can help older adults find support. Everyone in an abusive relationship needs help. What can you do when you suspect abuse of an older adult? Neighbors, friends, and family members are often aware of the signs of abuse in an older adult's life, but they may not know what to do about it. Here are three things that everyone can do to make a difference. Number one, see it. It's not right. Number two, name it. That looks or sounds like abuse. Number three, check it. Is it abuse? What can I do to help? So we're going to start with number one, see it. It's not right. Recognize the warning signs of abuse. Learn about abuse so that you can recognize the different warning signs. Abuse can be physical, but it can also be psychological, sexual, spiritual, financial, or neglect. The warning signs are not always obvious. All forms of abuse cause harm. It is easy to ignore warning signs and to tell yourself that you must be mistaken or that it's not that bad because it's only one warning sign. Trust your instincts when something makes you feel uncomfortable. A warning sign is like seeing the tip of an iceberg. There is likely much more going on below the surface. Some people think abuse is normal or understandable. Abuse is never acceptable. When you see a warning sign, say to yourself, it's not right. This will help you move to the next step. Which brings us to number two, name it. That looks or sounds like abuse. Talk to the older adult or someone you trust about your concerns. Overcome your hesitation to help. If it is safe, talk to the person who you think is being abused. Wait for a time when you are alone and not likely to be interrupted. Approach the person with care and concern. Say, for example, I heard your daughter yelling at you again, and I'm worried about you. Describe just the facts of what you witnessed. For example, do say, I saw him take money from your wallet. Don't use judgmental language. I saw him stealing money from your wallet. Do say, I heard your daughter say she didn't want to take you to the doctor. Don't use judgmental language or jump to conclusions. Your daughter is being abusive for not taking you to the doctor. Find support for yourself. Talk to someone you trust about what to do next or consult a professional.